In the name of God. Hi guys. In this session we want to learn about the shoulder girdle muscles. Muscles here divided two parts. One of them are muscles that connected upper limb to the vertebral column, and another muscles connecting the upper limb with the trunks. All of the muscles located in these regions are in these regions: back, scapular, pectoral, and deltoid. About the muscles in the back, we want to learn about two layers of them because these two layers is connected to the upper limb. Okay, for learning about the muscles, we should study from superficial to deep layers. The first layer is skin. After removing skin, you have fascia. Fascia divided two layers. First, superficial fascia that contain fatty and superficial vessels and superficial nerves or sensory nerves. And another is deep fascia. The fascia have two duties. One, cover the muscles. Another, descend or influence between the muscles and make the compartment. Descends the muscles and attach to the bone and make compartment, like compartment in the interior of the arm or posterior of the arm. In the interior of the arm we have flexor muscles. In the posterior we have extensor muscles. For learning about the muscles, it is necessary you learn about the origin of the muscles or beginning, insertion of the muscles or ending, action, and nerve supply. So, first we come back to learn about the muscles in the back. First, the first layer. In the first layer we have two muscles. One of them is trapezius, this muscle. Another is latissimus dorsi. In the first layer we have trapezius and latissimus dorsi. You look at the one part of the trapezius. This is like triangular, but with two trapezius. We have two trapeze in two sides, so this is make trapeze form, trapezius form. Muscles in the scapular, muscles in the back, muscles in the pectoral, and muscles in the shoulder that are muscles that we want to learn about them. First, muscles in the back. In the back we have 4 layers muscles, but we want to learn about 2 layers of them that connected to the upper limb. The first layer in the back we have trapezius and latissimus dorsi. Trapezius and latissimus dorsi. Trapezius, origin of the trapezius is coming from the occipital, ligamentum nocae, C7, T1 to T12 spines. All of the muscles gather to each other, twist to each other, and attach here. Upper border of the spine of scapula, medial border of the acromion, and posterior border of the clavicle. If you can imagine, these 3 parts make U form. That trapezius connecting to the medial of this U form. Okay, I repeat it. Acromion, spine of scapula, and clavicle make U form. Okay, and trapezius attached to the inside of this U form. Action of the trapezius. Trapezius upper fibers act with levator scapula and elevate the scapula. Middle fibers act with rhomboids and retract the scapula. Upper and lower fibers act with the serratus anterior and rotate the scapula forward round the chest wall, thus playing an important role in abduction of the arm beyond 90 degrees. Another action of this is steadies the scapula. But the important role of the trapezius for upper limb is abduction of the upper limb and steady of the scapula. Okay, abduction beyond 90 degree. Another muscles that we have is latissimus dorsi. Origin of the latissimus dorsi is from T6 to T12, coming from the iliac crest, sacrum, lumbar fascia, inferior angle of the scapula. All of the muscle twist each other and attach to the intertubercular groove, floor of this intertubercular groove, attached to the floor of the intertubercular grooves. Action of the latissimus dorsi is adduction, extension, medial rotation of the shoulder, as in swimming, climbing, pulling, folding, the arm behind the back, and scratching the opposite scapula. Another action is hold inferior angle of the scapula in place. Nerve supply of the latissimus dorsi is thoracodorsal, and nerve supply to trapezius is a spinal part of the accessory. Accessory nerve is 11 nerve of the CNS. It is better you know the principal action of the trapezius is to rotate the scapula during abduction of the arm beyond 19 degrees. Clinically, the muscles is tested by asking the patient to shrug his shoulder against resistance. Trapezius cover some muscles like levator scapula, rhomboid minor, rhomboid major, supraspinatus, infraspinatus, latissimus dorsi, serratus posterior, superior, and another muscles. But the second layer that covered by the trapezius, it is levator scapula, rhomboid minor, and rhomboid major, that we want to learn about this. First, levator scapula. Levator scapula, origin of these muscles coming from C1 to C4, and insertion is superior angle of the scapula and medial border of the scapula. Nerve supply branches from C3, C4, C5. Action elevated of the scapula. About the rhomboid minor and rhomboid major. It is better you know about all of the muscles that we have minor and major in anatomy. Major is muscles that support the minor. Huge them, support them. Okay? So, rhomboid minor coming from C7 to T1, this is the origin of these muscles, and attached to the medial border of the scapula, insertion of them. And rhomboid major is the muscles that origin of this is from T2, T3, T4, and T5, and insertion is the medial border of the scapula. All of these muscles, rhomboid minor as major, retracted the scapula, and nerve supply to the rhomboid minor is from C5, and rhomboid major is C5. Muscles in the scapular region contain supraspinatus, muscles here that name infraspinatus, muscles here tres minor and tres major, and muscles in the interior of the scapula that name subscapularis. First, about the supraspinatus. Supraspinatus originate from this fossa. You learn about this fossa. What is the name of this? Supraspinatus fossa, coming from here, and insertion of this is coming here and attached to the upper impression of the great tubercle. Upper impression of the great tubercle. Nerve supply suprascapular. Action initiate abduction of the arm and carries up to 50 degrees. Another muscle is infraspinatus. Infraspinatus coming from the infraspinatus fossa. Insertion is the middle impression on the great tubercle of the humerus. Middle impression on the great tubercle of the humerus. Nerve supply, suprascapular nerve. Action, lateral rotation of arm. Another muscle is tres minor. Tres minor originated from the upper two-thirds of the lateral border of the scapula in dorsal surface. Insertion is the lowest impression on the greater tubercle of the humerus. Nerve supply, axillary. Action, lateral rotation. Now you learned about three impression in the greater tubercle of the humerus: upper, middle, and lower. Another muscle is tres major. Tres major originated from the lower one-third lateral border of the scapula, inferior angle of the scapula. Insertion is the medial border of the intertubercular groove. Nerve supply, lower subscapular nerve. action, medial rotation, and adduction. Another muscles here in the scapular region is subscapularis. Origin of these muscles is from the subscapular fossa, insertion lesser tubercle of the humerus. Nerve supply upper and lower subscapular nerve. Action, medial rotation, and adduction. Deltoid region. In this region you have deltoid muscles. Deltoid muscles is the muscles cover the shoulder joint. Origin of this is lateral border of the U form. You learn about the U form in the insertion of the trapezius. You learn insertion of the trapezius attached to the medial border of this U form. But origin of the deltoid coming from the lateral border of the U form. So, origin of the deltoid coming from the anterior border of the clavicle, lateral border of the acromion, and inferior border of the spine of scapula. Insertion, all of the fibers twist to each other and attached to the deltoid tuberosity. Action. Anterior fibers have flexion of the arm. Middle fibers, abduction of arm till 90 degree. And posterior fibers, extension. Extension is working with the latissimus dorsi and terce major. You know, abduction of the arm, initiate of this abduction is with supraspinatus till 15 degree. Continuous of the abduction is with the middle fiber of the deltoid till 90 degree. And after 19 degree is with the trapezius. If we have disorder to action and initiate the abduction of the arm, so you can help the person initiate it, and another muscles like middle fiber of the deltoid and trapeze do continuous of the abduction. So initiate of this is with the supraspinatus. Pectoral region. In the pectoral region, we have three muscles. After skin, you have pectoralis major. And depth of the pectoralis major, we have pectoralis minor. And another muscle is subclavius. First about the pectoralis major. This major originates from the anterior and medial of the clavicle, anterior of the sternum, and cartilage of the true ribs from 1 to 7, that name true ribs. And insertion of this is lateral lip of intertubercular groove. Nerve supply by the medial and lateral pectoral nerve. Action. Medial rotate and adduction. Medial rotation and adduction of the arm. Sternocostal fibers with latissimus dorsi and terce major extend the arm. Clavicular fibers with coracobrachialis turned arm medial and anterior. Another muscles that we have in the depth of the pectoralis major is pectoralis minor. Origin of these muscles coming from the third, fourth, and fifth anterior and lateral surface of the rib and attached to the coracoid process. Nerve supply, medial pectoral. Nerve supply, medial pectoral. Action. With serratus anterior, pull scapula. Pull down the scapula and shoulder.